microneedling is a non-invasive treatment where it stimulates collagen production and also is rebuilding your skin tissue. When struggling with things like scars, pigmentation, sun damage, or even just fine lines and wrinkles, it really helps to rebuild the skin naturally. SkinPen is a result-driven microneedling device. It is FDA approved, which makes it safer than other devices. Also, each SkinPen kit comes with a sterile tip within each treatment. Each treatment provides 3 million microchannels to the skin, which is giving you full-blown rejuvenation. SkinPen is definitely my favorite to use when I treat a patient with microneedling.
There are a variety of different things that you can get microneedling for. One of the first of them is acne scarring. Acne scarring, I see a lot in teenagers, even older clients as well. For scarring, I do say that you need about 3 to 4 treatments, depending how deep the scars are. Microneedling will kind of break up the layer of the skin that has the scar, and we're rebuilding new skin to create the flat surface that you want without scarring. Another thing that you can do microneedling for is pigmentation, like we did on Pam today. If she had a lot of sunspots, it will help to break them up and kind of loosen up the dead skin that is there and where the sunspots are. Again, for that, I would say a couple treatments. A lot of the time sunspots can come from when you were younger and you just have no idea, or times that you weren't wearing sunscreen. Once we can get into the deeper layers of your skin, the new skin will grow without the sunspots, and from there we kind of just prevent it. For microneedling, when we do pigmentation, we always recommend that you get laser treatments as well, just to help pull out the pigmentation from the skin as opposed to just breaking it up with the needles. A lot of the time, another thing you can do microneedling for is for loose skin. Microneedling will help tighten your skin by creating that new layer, and it kind of promotes a collagen boost because your skin is trying to heal after the treatment. So you'll feel that day that you feel tighter just then, and over time as the collagen production works, you just continue to feel that process of the skin tightening, and you get overall rejuvenation, just a new clean layer of skin that looks nice, bright, it's less dull and more tightened.
Hey guys, Carly here, and I'm going to talk a little bit about PRF. Now PRF goes hand in hand with microneedling, or it can be a completely separate service. Now over the last couple of years, we transitioned from PRP to PRF, and a lot of people might not even realize that there's a difference, or they might not even realize that they're getting one versus the other. So I'm just going to do a quick explanation of what it is and what it offers you and how they're both different. Now, PRP is platelet-rich plasma, whereas PRF is platelet-rich fibrin. Now, the big differential is platelet-rich fibrin has no preservatives in it. So in PRP, when you draw the blood, you'll see, even in the test tube, I brought these test tubes out, you're going to see like a little bit of a plug at the bottom of the test tube, whereas PRF, you're not going to see any plug at the bottom. Now, this little plug has an anticoagulant in it and a preservative, which is sodium citrate. Now, this little plug at the bottom of the test tube, once you draw the blood and spin it down, it causes all the cells to separate, and then just at the very top, you're going to see all that plasma, which is all the good stuff that you want, the growth factors, the white blood cells, all the stuff that causes rejuvenation. Now, when you do the blood draw for PRF, there's no plug at the bottom, and naturally all the cells are going to separate. So there won't be any preservatives in there. There won't be any anticoagulants. Basically, the spin down, which is at a slower cycle, is going to cause all the cells to separate at a natural approach. And the reasoning for that natural approach is it saves a lot of the cells that we found over time actually cause more rejuvenation. So at the top, you'll see all the good plasma, Plus, in that extra plasma, because there's no preservatives and no anticoagulants, you're still going to have white blood cells in there. You're still going to have platelets in there, some red blood cells, and all of that really aids in the rejuvenation process. So basically, we'll take all that plasma out and then we'll inject it. And what we're doing is we're going to create fibrin, or a wound underneath the skin, and that's going to cause this wound healing process, and you're going to see rejuvenation. So over the course of time, you're going to see this wound healing process for weeks. And you're going to, during this week process, you're going to see releases of growth factors and stem cells, and that causes rejuvenation. So with PRF, you're going to see a lot more rejuvenation because you're using a lot more natural, you're seeing a lot more of those natural cells that aren't clogged up, which is what the PRP can do. So you'll see rejuvenation over weeks and weeks at a time, whereas PRP, after about a couple days, that rejuvenation period goes away. So that's awesome. So usually with PRF, I'll have you come in, we'll do the injections, we'll create that fibrin or that wound healing effect underneath the skin. You'll see releases of stem cells and growth factors over weeks at a time. And then you'll come back in 6 weeks and we'll do it again. And you'll keep seeing those results for up to 6 months. So definitely a superior product is PRF over PRP.
Classic microneedling, which was shown within today's treatment, really provides a good standard for beginners when you want to try out microneedling for the first time. It uses a nice hyaluronic acid base to create the whole procedure to make sure it's comfortable, making sure that we're boosting that collagen and really targeting your concerns. And then there's always those additives with other treatments like the B5 vitamin infusion and then the PRF, but this is a really good start off to making sure that you like microneedling as a whole.
Alrighty, so we're going to start off by going through the supplies that we use for our microneedling treatment. I love to give patients a nice cooling mask right after her treatment to cool down the redness and inflammation. So I always give them this in a little box here to take home with them for aftercare. I always have some alcohol to make sure that the skin is nice and clean before we microneedle. Never want to microneedle in bad bacteria or oil or dirt because that could, give you an adverse reaction. I have a cleanser here, a headband to protect your hair, the microneedling pen. This is what it looks like. This is what it sounds like. Sounds a little scarier than what it is, but then we have a hyaluronic acid glide. That's for moisture. And then just some extra gauze. And then the numbing cream. First step is to apply our numbing cream. We have a good base right now. Just going to apply a little bit more for comfort. So it's going to make her comfortable throughout the microneedling treatment. All right, so the next step is we are going to remove the numbing cream. I like to be fancy and use a hot towel. So I'm just going to place this on here, just to kind of relax the patient before we get started with the microneedling process. Open up those pores. And then just to make sure that we got all the numbing cream off, I'm going to use some alcohol and some gauze. And then just make sure that we're keeping everything really nice and clean.
Next step is we are going to apply the hyaluronic acid glide to the skin. This is really going to help moisturize the skin and hydrate throughout the microneedling process. I like to put it on the back of my hand here and just start on the forehead. The forehead is what I like to call the spiciest place to treat. We have such thinner, more delicate skin on our forehead, so it tends to kind of feel the worst. Now we begin the microneedling process. I'm going to start her off at a 1 millimeter depth just because we're starting on the forehead and it's kind of the area that might hurt the worst. So we're going to start her off with that. Let me know if you're uncomfortable at all, okay?
Yeah.
So right here on the cheeks, I'm going at a 1.5 millimeter depth to really pinpoint those pores. and making sure that we're boosting collagen around the crow's area. Microneedling is just boosting that collagen, creating trauma to the skin to rebuild the epidermis. All right, so now at a 2mm depth, I'm going to do something called stamping. Stamping is where you want to break up, the pigment or the scar, just to rebuild that collagen over the skin. So I'm just gonna go at a 2mm depth and just stamp right on the spot that I see, just for a couple seconds, and then remove. You'll definitely have some pinpoint bleeding here. But this is really going to trigger the skin to rebuild over that damaged area. The places where I am stamping might take a little bit more longer to heal. So now we are going on to the nose and the lip area. So we use a lower depth in these areas. It's very normal to have the feeling that you need to sneeze when treating these areas. Once we are finished with the microneedling treatment, I'm going to moisturize the skin with the rest of the hyaluronic acid glide. This is going to really help lock in that moisture and send her on her way for the rest of the day. So after the microneedling treatment, you are definitely going to be red, almost looking like you have a sunburn. It's totally normal. The normal healing process takes about 1 to 2 days. And I give you a personal complimentary cooling mask to really help the redness and inflammation heal faster. So going over aftercare, you're definitely red. I'm going to give you a complimentary cooling mask. This is really going to help calm down the redness, inflammation. What you want to do is stay out of the sun for about 48 hours or as long as you can until your skin's fully healed. But what I would do tonight is I would just wash your skin with some cool water and then apply your cooling mask. I always kind of recommend putting the cooling mask in the fridge so it's nice and cold, but no hot showers, no saunas, and no pools for about 48 hours or until your skin is fully healed.
So this is my skin after the treatment. It usually goes away in like 2 hours, the redness, and it feels so smooth afterwards. All my products go on so easily, and there's a really noticeable difference in a couple weeks.
Usually the package runs for $975, but with this month's special, it's bringing it down to $900 for 3 treatments. And this is bringing each treatment cost down to $300 instead of that $325.
So this is our B5 hydrating gel. This is by SkinCeuticals. This is part of our new microneedling treatment. So we're calling it vitamin infusing microneedling. This has hyaluronic acid and B5. A lot of things don't have both of them in it, so this is kind of like a drink of water for the skin. It's really gonna repair her barrier. With the microneedling, what we're doing is breaking up the skin, so this is going to put all of the nutrients back into the skin that we're losing from getting the treatment. This is great for any skin type. It's going to give you tons of moisture and tons of nutrients that your skin needs after a treatment like this. using it during the treatment is really great, and then you can even purchase it to take it home with you and use it at home to extend the experience. So in a normal microneedling treatment, we use this glide, we call it, for microneedling. So instead of this, we're switching it out with the B5. B5 is really lightweight. It's great for summertime. It's not greasy, it's not heavy. Like I said, it's super light and just kind of feels like velvet on top of the skin as opposed to a really thick cream. Hi everyone, I'm Jen. I'm one of the estheticians here at Pure by Alpha Dermatology. Today we have my client Pam and we're going to do some vitamin infused microneedling. So basically tell me what you're looking for today.
My skin's very dull. I have a lot of dryness.
Yeah.
I'm a sun worshiper, so I have a lot of sun damage, sunspots.
Yeah, so microneedling is going to be great, especially with the B5 gel that we're going to use. It's by SkinCeuticals, so what we're going to do is use that first, and we're going to microneedle it into your skin. It's going to really help with all the sun damage up here. It's going to break everything up. And then using the vitamins, it's going to kind of give you that moisture back to your barrier, okay?
Okay.
Perfect. Well, first thing I'm going to do is we're going to start by numbing her just with a topical cream. I'm going to wipe her down, just make sure her skin is clean, and then we'll apply our numbing cream. The numbing we use for microneedling is just a cream. It sits right on the skin. We leave it sit for about 15 to 20 minutes to make sure there's no pain, you don't feel anything, and you're super comfortable during the treatment. So what I'm going to do is I'm going to start by just applying this to the skin, and I'm going to start on her forehead just because that's where I like to start, and then eventually we'll move down to her cheeks. At the top of the forehead, we usually use a 0.5 depth with the microneedling pen, so I'm going to go ahead and get started on that. Once we move from the forehead, I'm going to move down to the cheek, and we're going to bump the skin pen up to a level 1. After the cheeks, I'm going to move into her T-zone. We're going to hit her nose, top of her lip, and chin. This area I'm going to stay back on a 0.5 just because these are more sensitive areas. Lastly, I'm going to add the B5 gel just all over the full face so we can add all the moisture back into our skin. So for Pam today, we didn't go too deep. This was her first microneedling treatment. She has a couple summer vacations coming up, so we just wanted to give her the experience and work on some of the sun damage. It's going to help tighten her skin, but not to the extreme where she's going to take a couple days to heal. Her skin actually looks really great after the treatment right now, so she'll have a pretty quick healing process. So after microneedling, I normally recommend that you do 3 treatments. We do every treatment about a month apart. 3 treatments is really going to give you the extended benefits of everything that we're doing. She will see a difference after 1, but 3 is really going to push all the effects that we want to get. I like to have everyone back for a clinical evaluation after their package even. So if you get a package of 3, I'll probably see you in another month just to follow up and check and see where your skin's at.
How was your microneedling experience today?
It was wonderful. It was very relaxing. There was no pain. I really enjoyed the experience.
How does your skin feel after your treatment?
It feels good. It feels a little tight, but for the most part, it feels normal.
Would you recommend Pure by Alpha Dermatology to a friend?
I absolutely would. Jen has been amazing. I had 3 of the chemical peel treatments, which I saw a big difference in my skin. I've gotten the hydrofacial, with just the regular hydrofacial and the one with the infusion, and the results are amazing. And keeping up with my skin with the products that they sell here is a plus. Definitely use the products because they will make your results last even longer.
For the month of July, we actually have microneedling package discounts going on. For the vitamin infused microneedling with our B5 serum, originally for 3 treatments, gives you a package of 3, it's $1,200. This month we have a deal going on. You get all 3 treatments for $1,125, which gives you a savings of $25 off every single treatment.
Alrighty, microneedling with PRF is a really special microneedling treatment. It is one of my favorites. I absolutely just love the PRF added to this treatment because it's going to help heal the skin faster, helps with rejuvenation, tightening those pores, and overall super hydrating for the skin. It really helps with anti-aging properties as well to give you that nice tightening effect. Alright, so now they're done spinning down, I'm going to put the tube for the microneedling right in the cooling. This is really going to help separate everything and get the best fibrin for the microneedling process. Alright, so this is our PRF, which is also known as platinum-rich fibrin. This consists of growth factors, hydration. It really helps the healing process fasten with something like this treatment, like microneedling, that we're creating that trauma to the skin. So when this is applied and actually microneedled into the skin, it's creating a really great healing process, but also giving you that extra boost and also really great anti-aging and hydrating properties. So what I'm going to do here is just apply it onto the skin. Just want to have a really good amount on the skin here, so that we have a great amount to microneedle in. So I'm just going to start on this side here. And now we are going to start the microneedling process. I'm going to start here at a 1 millimeter depth. Since she has previously gotten the microneedling treatment, we can hit a little heavy. Let me know if this is uncomfortable at all, okay? Nope. Perfect. So as you can see, we are microneedling the PRF into the skin. You're going to see pinpoint bleeding here in this area. That's a good thing. Boosting that collagen, hydrating the skin. PRF really takes microneedling to the next step. Out of all of our microneedling treatments, this is probably my favorite, just because it's really giving you a really nice glow, leaving the skin really rejuvenated and refreshed in a natural way. So you're not putting any product on the skin. This is your own hydration. This is your own growth factors, giving back to your skin and boosting collagen. Alright, so my patient here has a couple deep scars that I really want to treat. The really great thing about the skin pen device that we use is when you stamp, which I'll show you during the treatment, this is really going to help rebuild the skin tissue over top of that scar, rebuilding the skin there, and really giving you a nice smooth appearance. So I'm going to go at a higher depth and really stamp that scar, and that is going to trigger the skin to rebuild in that area. So at a 2 millimeter depth I'm at right now, I'm just going to stamp. So let me know if you need a break or not. Sorry, I know it doesn't feel the best. Just leaving it on there for a couple seconds and then releasing. So these areas that you stamp, they might take a little longer to heal, but that's honestly a good thing, and that's what you want, because you want the skin to really signal into that area to rebuild and heal that scar. So going back down to that 1 millimeter depth, I'm just going to go over and really boost that collagen in that area. So how is this feeling?
Well, it vibrates a lot, so it's actually just tickling me.
That's definitely normal with when treating the forehead, because we have that thinner, more delicate skin, and it's actually really normal to feel like you have to sneeze. So let me know if you have to sneeze at all during the treatment.
Yeah, it's not painful at all.
Perfect. You okay? So now we're at I'm gonna actually go to 1.5 here. Really boosting that collagen, really targeting that pigmentation. Microneedling not only helps with acne scars, it's really great for sun damage and pigmentation concerns, because it's going to break up that pigmentation in those areas and help rebuild the skin, especially with PRF, because it's really helping to brighten the skin and rejuvenate. It's funny because the microneedling device actually sounds a lot scarier than what it is, but I have patients that put headphones in and then they just fall asleep mid-treatment. So since she has a little bit more discoloration right here in her lower jaw area, I am gonna go at a 2 millimeter depth. This is really going to break up that pigment and boost collagen in this area, giving a nice rejuvenated look. And it's so crazy because I'm really at a high depth, but with PRF, I feel like it really helps to calm down that redness throughout the procedure. Like I said, it's really helping the healing process overall. It looks and sounds painful, but it can be one of the most relaxing facials. So now we're just taking a little bit of that extra PRF and patting it into the skin to really hydrate. Everything's open right now, so applying the PRF really helps to calm down redness and really hydrate that moisture barrier. Then on top, after I apply the PRF, I'm just taking the Skin Pen Skin Fuse Hyaluronic Acid Moisturizer to complete the treatment. And she should be ready in about 2 days to get back to in the sun and to use her retinols. I give everything about 48 hours. Just be very gentle with your skin for about 48 hours. No retinols, no sun, and clean your pillowcase. It's a small tip, but.
Alright, so I just got done my microneedling with PRF. This is actually my third one that I've done, my third treatment. The first two were just the regular classic microneedlings. With the PRF though, I'm definitely a lot less red than I was with the first two, so that makes me happy because I can tell that I'm already going to be so rejuvenated tomorrow morning. But I really like it, microneedling. I know that it helps me, which is why I keep getting it done, because I mean, the progress and the process is like simple and easy and you don't really feel it. I know that it tickles because the tool vibrates, so it's not painful, but yeah, come and get it done.
This package this month, you are saving $150 on a package of 3 at a price of $1,800.
3 test tubes for the Easy Gel. The orange one is going to go in first, and we do this at a little bit higher speed and a little bit longer to create our albumin, which is going to be the plasma that we're going to then heat. These are the ones that we're going to use for our PRF for the microneedling, and then to combine with our albumin. So these are going to go in the little cooler, and we put them in the cooler so nothing clots, and that it stays in the liquid form. And then this one is the one we're going to do first. So we'll close that off, and we'll let it spin for about 7 minutes. So the platelet pour serum came out, and it's beautiful. You can see how pretty it is. And this is what we're going to heat up and use as our albumin. Now I usually take the top off. I'll put a needle in here, and I'm going to draw up that serum. So it came out perfectly. So in this serum, you're going to have platelets, you're going to have white blood cells, red blood cells, growth factors, all the good stuff. And you can see here, basically from spinning it down, the centrifuge basically separated all the layers naturally. So you don't need that preservative, that sodium citrate, and that anticoagulant that's found in the PRP. I mean, it's just additive product that's not necessary, because your body and the centrifuge does everything. All right, so now that we have this, I'm going to put the top on, and then I'm going to put it in here. This is going to come here. Look for the top. Okay. And we're going to put it right in here, and then that's going to go in for about 10 minutes. And then I'm going to take my other tubes that have been sitting in the cooling area. And just hold this for me, Carly. And now I'm going to spin these two. And we're going to spin these at a little bit lower rate, so we really can preserve as much plasma as possible. And we'll start. So this is heating, this is spinning. And then after all this is done, we're going to combine them, and they'll be ready to be injected. Awesome. All right, so our one syringe came out of the heater. So it kind of looks like this. This is all of our albumin, and we're going to combine this with our PRF and form that into a gel. And we'll basically yield about 5 mLs. So I always tell people 5 mLs is equivalent to about 5 syringes of filler. So you're really getting a lot of product all naturally from your body. So basically I'm going to put this on here. I'm going to draw this up. So you can see here, there is a little clot there. So you have to be really careful, because that's the difference between PRF and PRP is in PRP, you're not going to get any of that clotting. PRF, because you don't have that anticoagulant and preservative, you are prone to some clots in there. But in here, we're all liquid, which is great. So now I'm going to take my PRF and the albumin, and I'm basically going to combine it into a gel. the patient yielded a ton of plasma, which is awesome for her. So she might even be getting close to about 6 mLs, which is, again, each syringe of filler is only 1 ml. So she's getting about 6 mLs of Easy Gel, which again is amazing for rejuvenation, and we're going to basically restore her face by ongoing releasing of growth factors and building back up all that deficit that we're starting to lose as we age. So that's pretty good. Now after I do all that, we can combine it into little syringes, and then it'll be ready for injections. So there's one. Two. Perfect. So she yielded about, it came out to basically 5 mLs. So all of this is Easy Gel. So this is all going to be injected, and she's going to have amazing results and be so happy. All right, so we're going to be doing Easy Gel or PRF underneath this patient's eye. Both eyes. She's had multiple treatments before. Her under eyes are significantly better than what they were. We'll show some before and after pictures. But first, what I'm going to do is just create a little entry point, which she really shouldn't feel this at all. I gave her a little bleb of lidocaine right where these dots are. So I'm going to do a little pinch. Do you feel anything?
No.
Okay, good. And that's basically the entry point is just for the cannula to go into the skin, and she'll basically just have one injection point, and then we'll thread all the Easy Gel underneath her eye. She can expect some swelling for the first day or two. Did you, like you said, you had some swelling for a couple days,
Yes.
and then it really dissipates. And then, like I was saying in other videos, that fibrin or that wound starts to form underneath the skin, and then all those releases of those good cells start happening. So releases of the white blood cells, the platelets, the growth factors, the stem cells start happening, and you'll see that release from the fibrin underneath the skin for 3 to 6 months from what the studies showed. So she'll probably come back again for another treatment in about 6 weeks. A little bit of pressure. You okay?
Yeah.
A little bit of pressure. You okay?
Mm-hmm.
You all right?
Yeah.
All right, now you can kind of see the cannula where it is. You see me pushing up? It's right there. So what we're going to do is do a little deposits, and you can see it actually filling right up underneath her eye and giving her that volume loss, filling in that area where she has the depletion. Now, a lot of this is hereditary, and we can make it better with these treatments. She could do some laser treatments as well, and then I am going to get her on a good 2 great under eye creams. So retinol eye cream at night, and then a cream for pigmentation in the morning. And that's it. How was that?
Good.
Not too bad?
Mm-mm.
Great. Look at me. Look up. So you can see here the volume fill for there versus there, which is awesome. Now we will do a little bit, I'm going to do a little bit more here right on the bone as well. but we got really into that tear trough area nicely. So PRP, she's had both PRP and PRF. Because PRP, like I said before, has that preservative, that sodium citrate, when you inject, the patient experiences burning, which is, she complained of that when I did her under eyes before, where she's like, oh, it's burning. And then I did the PRF on her, and there's no burning, which again goes to show it's completely natural. There's nothing in the test tube when we're drawing her blood to cause it to clot or to separate out all the cells. So completely all natural and painless. Did that hurt at all?
No.
Okay. So, all right. So I'm going to do another little entry point like I did on the other side. And basically the same exact thing using a cannula. Now I get this question a lot too, is why would I pick this over a filler? So this is a really vascular area. For filler, it can be a scary zone for some injectors because there's so many nerves, there's so many veins, blood vessels in that area. So a lot of injectors and people feel that doing PRF or PRP is a lot safer. And it gives a much better natural result. I can't tell you how many times I've had people come into the office and say, I had filler under my eyes, I want it dissolved, because it gets bumpy and you can get little nodules and it can get puffy. Whereas this, no nodulars can form. You will be puffy for like 48 hours, but that dissipates. You don't get any lumps or bumps or any after effects like filler can. But you can do filler. I would do very specific fillers. I like RHA2, which is from the RHA collection. You could do Restylane from, that's really safe, but tiny amounts, not a lot. So people could do filler if they want that immediate effect, if they are struggling to say, I don't want to wait 3 to 6 months to really see the effects. If they want, this weekend, I want my eyes fixed, they would be a perfect candidate for that. This takes time, and it usually takes a couple of treatments. You can even mix filler with PRF, so you can do like a combination and you can mix it in a syringe. That's really cool. I've done that for patients before. So not only are you getting a little bit of filler, but you're also getting the PRF. That's a great option too. You all right?
Mm-hmm.
You can again see the cannula, it's right there. We're gonna slowly fill that area. A lot of people do fill the cheeks with filler because that will kind of offset the under eye hollowing as well. So that's another option. That's why when we do Easy Gel, we target the cheeks and the fat pads, because that's where we want those stem cells and growth factors to be deposited so you can get regrowth and you can get that volume back. Look up. Perfect. Looks great. How do you feel?
Good.
Painless?
Nope. Yep. No pain.
No pain.
Mm-hmm.
Perfect. And no burning, right?
Nope.
And you can see she really shouldn't have any bruising because we did basically one entry point, which you can see right here. And we used a cannula and we just deposited basically about 1 ml of product. And then we can also then go to fill in her cheeks here a little bit. And right in here, and then we could also do a little bit in her target, in her nasolabial folds. She has good volume down here. We could target back here on her jawline as well. But this was a great response. Perfect. So Mona's done. She just has a little, I'll probably put a Band-Aid here or there. Now she's gonna see, if you look up for me, she has this puffiness right here. That's basically where we laid the PRF. So that's going to dissipate probably in the next 48 hours. And then, like I said before, I laid all that PRF or that Easy Gel underneath the skin, which then creates this wound healing effect in her body. Like if you were to get scratched or your body needed to heal something, that's what starts happening. And that causes the release of growth factors, stem cells, white blood cells, platelets to all be released and to start healing that area and basically bringing back fat cells that have been lost and bringing back volume. So this will basically all go away in the next 48 hours, and then over the course of 3 to 6 months, she's really gonna see it's gonna slowly start coming back because she's gonna be bringing back that collagen that she's lost.
It was great. I loved everything I got today. It was nice and easy and painless. This is my third treatment. I would definitely recommend to anybody who's going through this dark circles or hyperpigmentation area. Yeah, I loved it.
All right, so we're going to talk about the July specials. For this month, we're offering an awesome deal for PRF injections or Easy Gel with microneedling. Now you will get 2 sessions. Each session will be $1,500, so for a total of $3,000. You'll get 1 session, and then 6 weeks later, you will get another session. Now you would come in, you get your blood draw, you would get microneedling with PRF, and then you would get the Easy Gel injections afterwards. That is a savings of $600.